Stop everything you are doing right now. What I am about to share with you in the next 25 minutes could literally save your life, or the life of someone you love, especially if you are over the age of 60. Hi, I'm Dr. William Lee. Over the past few years, the world has become very familiar with COVID-19, a virus that changed millions of lives. But now another virus is making headlines, Hantavirus. So the question is, which virus is actually more dangerous? Which one spreads faster, and which one is more deadly? In this video, we'll break down the science, the symptoms, the survival rates, and the real-world risks behind both diseases, separating facts from fear. Stay with me, because some of the answers may surprise you. Right now, while the world still talks about COVID-19 and its variants, a far more lethal virus is quietly moving through homes, garages, cabins, and rural properties across the globe, striking people with almost no warning. It doesn't spread through a crowded subway. It doesn't travel through a cough in a restaurant. Instead, it hides in the dust of forgotten places, places most of us go to without a second thought. It is called hantavirus, and unlike COVID-19, when hantavirus hits its severe form, known as Hantavirus Pulmonary Syndrome, it kills nearly 1 in 2 people who develop full lung involvement. Not 1 in 100, not 1 in 50, nearly 1 in 2. Let that sink in. I am Doctor, the founder of BioDoctor. I have spent my career studying how viruses behave differently inside aging bodies, how the immune changes that quietly happen after 50, after 60, after 70 turn ordinary exposures into life or death emergencies. Today's video is the most comprehensive breakdown I have ever done on hantavirus. We are going to cover exactly what hantavirus is and how it attacks the body on a biological level, why it is more life-threatening per case than COVID-19, the terrifying progression timeline from first symptom to respiratory collapse, real verified cases, including the 2026 cruise ship outbreak that shocked the international medical community, a side-by-side comparison with COVID-19 so you can tell the difference, and the 5 critical actions, the exact steps, that every adult over 60 must take this week. Stay until the very end. Step number 1 is the one almost no one does, and it may be the most important thing you do for your health this year. If you are new here, welcome to BioDoctor. I personally read every single comment on this channel. Right now, before we dive in, drop your age in the comments and tell me, have you been near any rodent-prone spaces recently? A shed, a barn, a storage unit, a vacation cabin? Your answers help me understand who is watching and help me create better, more targeted content for you. Let's begin. Before we talk about biology, I want to give you the number that every person over 60 needs to understand. Hantavirus Pulmonary Syndrome, the lung-attacking form of hantavirus found primarily in the Americas, carries a case fatality rate of 38 to 50% in its severe form. COVID-19, even at its absolute worst, during pre-vaccine peaks in 2020 and 2021, had an overall fatality rate of roughly 1 to 3% across general populations. That means, on a case-by-case basis, when hantavirus progresses to full pulmonary involvement, it is roughly 15 to 25 times more deadly than COVID-19. Now, I want to be very clear here, hantavirus is rare. You are far more likely to encounter COVID-19 in your daily life than hantavirus. We are not here to cause mass panic. We are here to make sure that if you ever face this exposure, and millions of people do every year without knowing it, you have every piece of knowledge you need. Let me give you some global context. The World Health Organization and the Pan American Health Organization estimate that between 10,000 and 100,000 or more hantavirus infections occur worldwide each year. In 2025 alone, the Americas reported 229 confirmed cases, with 59 deaths, a case fatality rate of 25.7% for that reporting period. Asia and Europe deal with a different strain that primarily attacks the kidneys, called hemorrhagic fever with renal syndrome, or HFRS, affecting hundreds of thousands more. And then in early 2026, the MV Hantavirus cruise ship outbreak involving the Andes virus strain sent international health alerts through the Americas and Europe as travelers returning from South America tested positive, raising alarming questions about whether this strain's limited human-to-human spread potential was wider than previously understood. We will come back to that case in detail. First, Let me tell you exactly what this virus is and why it behaves so differently from what you already know. To understand why hantavirus is so dangerous and why it is particularly dangerous for older adults, you need to understand what it does inside your body. I want you to picture your lungs as a delicate pair of sponges. Under normal conditions, they are flexible, aerated, and highly efficient at one job: pulling oxygen from the air you breathe into your blood. COVID-19, when it attacks the lungs, causes inflammation. It triggers an immune response that makes those sponges swell and stiffen. This is serious, and it can be life-threatening, but it typically unfolds over days to weeks, giving medicine time to intervene. Hantavirus does something different. Hantavirus turns those sponges into leaking water balloons, and it does it fast. Here is the biology. Hantavirus is a single-stranded RNA virus. It belongs to the Bunyaviridae family. It is carried silently by rodents. Deer mice are the primary reservoir in North America, while different rodent species carry different strains across South America, Asia, and Europe. These rodents carry the virus for their entire lives without getting sick. They shed it constantly, in their urine, their droppings, and their saliva. The virus can survive in dried rodent waste for days, sometimes weeks, depending on temperature and humidity. When a human disturbs that dried material, sweeping out a garage, cleaning an old cabin, moving boxes in a shed, the particles become aerosolized. They hang in the air. And when you breathe them in, they enter your respiratory tract and begin traveling directly to the endothelial cells, the thin layer of cells lining your blood vessels inside your lungs. This is where the damage happens. Hantavirus causes massive endothelial dysfunction. Those vessel walls stop being barriers and start leaking. Fluid pours from your bloodstream into your lung tissue, flooding the alveoli, the tiny air sacs that are responsible for oxygen transfer. Within hours of this process beginning, you are suffocating on fluid inside your own lungs. Your oxygen levels plummet. Your heart begins to strain under the load. This is Hantavirus Pulmonary Syndrome. And unlike most respiratory emergencies, it can progress from mild flu symptoms to complete cardiopulmonary collapse in as little as 24 to 48 hours. There is no specific antiviral treatment for hantavirus. Management is entirely supportive. The only chance of survival in severe cases is aggressive ICU care, often including ECMO, extracorporeal membrane oxygenation, which essentially breathes for you while your body fights. And here is the critical piece for our audience today. The older you are, the more dangerous this becomes. After age 60, a process called mucociliary clearance, your lung's natural defense mechanism for filtering out particles, declines by 30 to 40%. Your pulmonary reserve, the extra lung capacity you can call on under stress, decreases measurably every decade. Your cardiovascular system has less tolerance for the fluid overload hantavirus creates, and your immune system's ability to mount a rapid, coordinated antiviral defense is already 40 to 60% less efficient than it was at age 30. In short, the body that hantavirus encounters in an adult over 60 is precisely the body least equipped to survive it. Let's talk about transmission, because this is where hantavirus is simultaneously reassuring and terrifying. The reassuring part, unlike COVID-19, which spreads easily from person to person through respiratory droplets and aerosols in everyday environments, hantavirus almost never spreads between humans. You cannot get hantavirus by being in the same room as a sick person, by shaking hands, or by touching a contaminated surface, and then your face in the way we worried about with COVID. There is one important exception, and we will address it shortly, but for the vast majority of hantavirus strains worldwide, human-to-human transmission is not the risk. The terrifying part, the route of exposure, is one of the most common activities in the life of a homeowner, a retiree, or anyone who spends time in rural areas. Here is how exposure happens most commonly. You open a storage shed, or barn, that has been closed through the winter. Deer mice have nested inside. Their droppings and urine are dried throughout the space. The moment you start sweeping, moving boxes, or simply walking through, you kick up aerosolized particles. You open a vacation cabin that has been unoccupied for months. Rodents found a way in. The same scenario plays out. You clean out an attic, crawl space, or garage. Nesting materials, droppings, and dried urine become airborne. You work in agricultural settings, particularly during grain harvesting or handling, where rodents are common and disturbance is constant. You hike or camp in areas with high rodent populations and inadvertently enter spaces where rodents have been active. Research shows that the majority of hantavirus cases in the United States involve people who had no idea they were at risk. They cleaned a shed, they moved into a rural rental property, they spent a weekend at a cabin. These are not exotic activities, these are weekend errands. Now let me tell you about the exception I mentioned, the Andes virus. The Andes virus, found primarily in South America, particularly Argentina, Chile, and parts of Brazil, is the only known hantavirus strain with documented human-to-human transmission. It is limited and requires close, prolonged contact, typically household or healthcare settings, but it exists. The 2026 MV Hondius cruise ship incident involved Andes virus. Passengers who had visited rodent-endemic areas in South America returned aboard the ship with confirmed infections. Several cases developed on board or shortly after disembarkation. The incident triggered international repatriations, multi-country health alerts, and a sobering reminder that in an interconnected world, a regional virus can become a global concern within the span of a single itinerary. Older passengers on that voyage, those over 60, represented a disproportionate share of the severe cases. This was not a coincidence, it was physiology. Now I am going to walk you through what hantavirus actually feels like as it happens, the timeline from exposure to emergency. Understanding this timeline may one day save your life or the life of someone you love. The first symptoms of hantavirus look almost identical to a bad flu or early COVID-19. High fever, often 101 to 104 degrees Fahrenheit. Severe fatigue and body weakness. Intense muscle aches, particularly pronounced in the thighs, hips, and lower back. Headache. Chills. In many cases, gastrointestinal symptoms, nausea, vomiting, diarrhea, that COVID-19 does not typically cause. In the early phase, most people at this stage think they have the flu. Many take over-the-counter medications and try to rest it off. Some feel slightly better for a day or two, which creates a false sense of recovery. This is the window where intervention matters most, and where it most commonly fails to happen because nothing looks unusual yet. And then, with terrifying speed, everything changes. A cough develops. Shortness of breath begins. It might start mildly. A little winded walking to the bathroom. A slight tightness in the chest. But this is not a gentle worsening over days. In hantavirus, once the cardiopulmonary phase begins, it can escalate to respiratory failure in 24 to 72 hours. Here is what is happening biologically in real time. The fluid is flooding your alveoli. Your oxygen saturation, which should be 95 to 100%, begins to drop. When it reaches the 80s, you are in crisis. Breathing becomes labored. The heart, now fighting to circulate blood through oxygen-starved lungs, begins to show strain, reduced output, dropping blood pressure. Without ICU-level intervention at this exact moment, supplemental oxygen, potentially mechanical ventilation, potentially ECMO, mortality rates climb sharply. For context, COVID-19 can absolutely reach this level of severity, particularly in older adults, but it typically does so over 5 to 10 days, allowing more time for medical response. Hantavirus collapses in hours. This is why recognition is everything. If you or someone you care for develops sudden shortness of breath, any shortness of breath, following a fever and muscle aches, especially after any possible rodent exposure in the past 2 months, you do not wait. You do not monitor at home. You go to the emergency room immediately. And you say these words to the triage nurse, "I have had a possible hantavirus exposure." Those words change the treatment path. Statistics are critical, but real cases make the danger visceral and real in a way that numbers sometimes cannot. Case 1, Yosemite National Park, USA, 2012. In the summer of 2012, a cluster of hantavirus cases emerged among guests who had stayed in signature tent cabins at Yosemite National Park, one of the most visited natural landmarks in the United States. Deer mice had colonized the wall insulation inside the cabins without the knowledge of park staff or visitors. Guests breathing the confined air of those cabins unknowingly inhaled aerosolized viral particles. 10 cases were confirmed, 3 people died. The outbreak made international news and led to the closure and decontamination of hundreds of structures. The lesson? Hantavirus exposure does not require a remote wilderness encounter. It can happen in a commercial vacation property that passed its last inspection without issue. Case 2, Washington State, USA, 2020. A retired farmer in his early 60s spent a day cleaning out a barn that had been unused for several years. He wore no respiratory protection. Within 5 weeks, he developed fever, body aches, and what he described as the worst flu of my life. When shortness of breath began, his wife brought him to the emergency room. He was placed on a ventilator within 12 hours of admission. He survived, but spent weeks in intensive care and was discharged with permanently reduced lung capacity that changed the trajectory of his retirement. His pulmonologist later told him that the single factor most responsible for his survival was that his wife recognized the shortness of breath immediately and insisted on the ER visit rather than waiting overnight. Case 3, MV Hantavirus cruise ship, 2026. In early 2026, multiple confirmed Andes virus cases were identified aboard and in connection with the MV Hantavirus expedition cruise vessel. Passengers who had visited South American destinations with known rodent endemic zones returned to the ship with confirmed infections. Several deaths were reported, disproportionately involving older passengers. The outbreak triggered multi-country health alerts, emergency repatriations, and a global conversation about travel health screening for hantavirus in adventure and expedition tourism. The case highlighted a reality that many physicians and travelers had not previously considered. International travel increasingly brings people into contact with hantavirus endemic environments, and those over 60 traveling for nature experiences, ecotourism, hiking, rural stays, face an exposure risk that is rarely discussed in pre-travel consultations. Ongoing cases, southwestern United States, the Four Corners region of the American Southwest, where Colorado, New Mexico, Arizona, and Utah meet, remains one of the highest risk areas for hantavirus in the United States due to deer-mouse population densities. Sporadic cases are reported every year. The majority involve rural homeowners, agricultural workers, and people cleaning or entering structures that have been unoccupied. A disproportionate number are over the age of 60. COVID-19 versus hantavirus, the definitive comparison. Let me now give you the side-by-side comparison you came here for, the clearest picture of how these two viruses differ in every dimension that matters. Transmission COVID-19 spreads easily person to person through respiratory droplets and aerosols in any indoor environment. Hantavirus, for almost all strains, does not spread between humans. Exposure requires contact with infected rodent materials, primarily through breathing aerosolized particles in contaminated spaces. Incubation period COVID-19, typically 2 to 14 days. Hantavirus, 1 to 8 weeks. That extended silent window is what makes hantavirus so insidious. By the time you are symptomatic, you may have completely forgotten the moment of exposure. Early symptoms, near identical in the early prodromal phase: fever, fatigue, muscle aches, headache. The distinguishing features of hantavirus are the severity of lower body muscle pain, particularly thighs and back, and prominent gastrointestinal symptoms that are less typical of COVID-19 in its early stages. Disease progression COVID-19 can worsen over 5 to 10 or more days with a gradual decline in oxygen saturation. Hantavirus. Once the cardiopulmonary phase begins, deterioration to respiratory failure can occur within 24 to 72 hours. Case fatality rate COVID-19 overall, approximately 1 to 3%. Hantavirus Pulmonary Syndrome, severe form, 38 to 50%. On a per case, per severe progression basis, hantavirus is categorically more lethal. Treatment options. Both are primarily managed with supportive care. COVID-19 now has several antiviral and antibody therapies that reduce severity. Hantavirus has no approved specific antiviral. Management relies entirely on ICU support, oxygen therapy, mechanical ventilation, and in the most severe cases, ECMO. Risk to older adults. Both viruses carry elevated mortality risk for adults over 60. Hantavirus, however, progresses so rapidly that the physiological reserves of an older adult are challenged more acutely and with less time to compensate or respond. The takeaway is not that you should fear hantavirus more than COVID-19 in your daily life. COVID-19 remains far more prevalent. The takeaway is that if you ever face a hantavirus exposure, the stakes are higher per case, the progression is faster, and the window for successful intervention is narrower. You need to know this. The 5 critical actions every adult over 60 must take this week. We have covered the science, the cases, the comparison. Now I am going to give you the 5 specific actions, the exact steps that every adult, particularly every adult over 60, needs to take this week. Not someday, this week. Stay with me through number 1. It is the step almost no one takes, and it may be the highest value health action you take this year. Action number 5, conduct a full rodent audit of your property. This week, not next month, walk through your garage, attic, shed, barn, storage areas, crawl space, and any vacation properties you own or regularly access. You are looking for 3 things: rodent droppings, small dark pellets, often found along walls and in corners, nesting materials, shredded fabric, paper, plant matter in hidden spaces, and gnaw marks on wood, wiring, or food packaging. Before you enter any enclosed space that has been unoccupied, open windows and doors and allow cross ventilation for at least 30 minutes. Never enter a sealed, dusty, potentially rodent-inhabited space with no air exchange happening. Action number 4, know your PPE and use it correctly. If you are going to clean or work in any space with evidence of rodent activity, PPE is not optional. Respiratory protection, an N95 respirator, not a surgical mask, not a cloth mask. The N95 creates a tight seal and filters at the particle level where aerosolized viral material exists. A surgical mask does not. Gloves, nitrile gloves, not fabric, double glove if heavy cleaning is involved. For significant cleaning operations, Tyvek coveralls to protect clothing and skin. Seal and bag all protective gear in heavy plastic bags after use. Wash hands and face thoroughly. Action number 3, use wet cleaning methods only. This is the step most people get wrong. Never dry sweep, dry mop, or vacuum a space with rodent droppings or nesting material. Every dry disturbance of those materials launches viral particles into the air you are breathing. The correct method: prepare a solution of 1 part household bleach to 10 parts water. Spray the droppings, nest material, and surrounding area generously. Let it soak for a minimum of 5 minutes. This inactivates the virus. Then, wearing your PPE, use damp paper towels or rags to wipe up the material. Double bag all waste in sealed heavy plastic bags before disposal. This applies to the entire floor and surface area of the space, not just visible droppings. Treat the entire zone as potentially contaminated. Action number 2, know the red flag symptoms and your ER protocol. Memorize this combination. Print it out, put it on your refrigerator if you need to. Fever plus severe muscle aches, especially in the thighs and lower back, plus any shortness of breath following any possible rodent exposure within the past 1 to 2 months equals emergency room visit. Immediately. Not urgent care, not a telehealth appointment, emergency room. When you arrive, use these exact words at triage. I may have had a hantavirus exposure. This changes your triage pathway. It ensures the team tests for hantavirus specifically and does not treat you as a routine flu case, which would delay the ICU level care that may be life-saving. Time is the single most critical variable in hantavirus survival. Every hour between the start of the cardiopulmonary phase and ICU admission reduces survival odds. Action number 1, have the doctor conversation. This week. This is the step almost no one takes, and it is the most important. Call your primary care physician this week and schedule an appointment specifically to discuss hantavirus risk as it applies to your life. Bring the following to that conversation: a description of your living environment and any activities that involve rodent-prone spaces, a list of your current medications, because certain conditions and medications affect how your body responds to rapid fluid overload, a direct request for your physician to note hantavirus risk, exposure history relevant on your chart. Why does that note matter? Because if you arrive at an emergency room in distress and cannot speak for yourself, that notation on your chart guides the care team immediately. It tells them to think hantavirus. It tells them to contact an ID specialist early. It tells them to assess whether an ECMO-capable facility is nearby for transfer if needed. Early recognition combined with early transfer to a facility that can provide ECMO is the combination most associated with survival in severe hantavirus cases. That chain of events begins with your chart. It begins with one conversation with your doctor this week. This is not alarmist. This is preparation. And preparation, not panic, is what BioDoctor is about. You now know more about hantavirus than most primary care physicians will tell you in a standard appointment. You know the biology. You know the timeline. You know why it is more lethal per case than COVID-19, higher fatality, faster collapse, no specific treatment, and a body over 60 that is physiologically less equipped to survive it. But you also know exactly what to do. 5 actions this week. Audit your property for rodent activity. Know your PPE and use it correctly. Use wet cleaning methods only. Know the red flag symptom combination and your ER protocol. Have the doctor conversation and get it on your chart. You are not helpless. You are informed. And an informed person takes the right action at the right moment. Protect your independence. Protect your cabin weekends and your garden time and your property. Protect the people who depend on you. If this video gave you something valuable today, hit like right now. Subscribe to BioDoctor and turn on notifications so you never miss a video like this one. And share this with one person over 60 that you care about. One share could save a life. Before you go, leave me 2 things in the comments. What surprised you most? The fatality rate difference, the rapid progression timeline, or how common the exposure routes are? Have you ever cleaned a rodent-prone space without proper protection? Be honest. Your answer helps me understand this community. Thank you for watching. Thank you for taking your health seriously. This is BioDoctor, empowering you with real medical knowledge so you can make better decisions for yourself and the people you love. Stay safe, stay informed. I will see you in the next video.